So I'm going to talk a little bit about some of the work we've been doing in Washington around engaging communities to build resilience around wildfire smoke. I know you've heard from my other colleague Annie and other folks that we too in Washington are experiencing a lot of wildfires and wildfire smoke impacts. This is from September, oh, maybe it's not working. I'm going the wrong way. September of 2017, and if it were working, you would be able to see that the smoke just kind of covers the entire state. It was supposed to give you a sense of the breadth of the smoke impacts that we're experiencing. This is a chart that shows the percent of summer days, so June through September, for the past several years that have been rated across the state as moderate to hazardous air quality on the Washington Air Quality Advisory. The Washington Air Quality Advisory is what we use in Washington, the WACA, and it is a little bit more protective than the EPA's air quality index to determine which days are hazardous and unhealthy for people to breathe. So you can see from this graph that we have experienced over the past 2 summers a large number of moderate to hazardous air quality days and a lot of hazardous and very unhealthy days as well. This is a picture of the state of Washington in August of 2018, and these little red dots are our federal or federal equivalent monitors across the state, and you can see that in August there was really no clean air to breathe in the entire state of Washington. So the impacts that we're experiencing are pretty profound. So we at the University of Washington have looked at a lot of the evidence that Dr. Reed and Dr. Rappold talked about yesterday, and we realize that these events are having significant health impacts for our communities, but we really wanted to know, what do our communities need to be able to respond, to be able to protect health? You've heard a lot earlier today about the lack of evidence or the minimal amount of evidence around the effectiveness of some of these intervention strategies to reduce risk for wildfire smoke exposure. And so our communities in Washington are really grappling with what they should do and what they should do now, because they are experiencing this in real time. So we've been partnering with some organizations in Okanogan County, Washington. Okanogan County is the largest county by geographic area in the state of Washington. It borders British Columbia. It is the red highlighted county in that map over there. And we've been working with a few community organizations, including the Methow Valley Clean Air Project, the Okanogan River Airshed Partnership, and the Confederated Tribes of the Colville Reservation, as well as the Health Department and others, to figure out what we can do as a community to be able to address wildfire smoke risk. And so a little bit about Okanogan County. I mentioned it's the largest county and area in the state of Washington. It's also a very rural county. We have about 41,000 people living there, and you can see it's about 7.8 people per square mile compared to 101.2 people in the rest of the state. So it's very rural. These are some facts that I picked out to give you a sense of the community and are not all of the community, but because we have the Confederated Tribes of the Colville Reservation in this area adjacent to the county, there's a large American Indian population. We have about 13% compared to 1.9% across the rest of the state. We also have a larger population of Hispanic and Latinos in the area. The median household income is about $42,600 compared to over $66,000 in the rest of the state. There is a lower number of people living in the area who have a broadband internet connection, as well as a lower number of people with access to a computer in this community. And there are about double the amount of people who are of adult age under 65 that are living without health insurance compared to the rest of the state. So that gives you a kind of a snapshot of where we're working. And so this community has been dealing with about 5+ years of wildfires and wildfire smoke impacts, starting with the Carlton Complex fire of 2014, which destroyed over 350 homes. It was followed by the 2015 Okanogan Complex fire, which is about 5 fires combined. And together, those 2 fires destroyed about 28, or burnt, I should say, burnt about 28% of the entire Okanogan County. Those were followed in 2016 by mudslides and fires, which were mudslides and flooding, I'm sorry, which were secondary hazards of these fires. In 2017, there was a nearby Diamond Creek fire, which led to significant smoke impacts in the county. Again, in 2018, there were the Crescent fires and McLeod fires, which led to more smoke impacts. And already in 2019, we've seen 1 day of smoke impacts so far from fires in British Columbia. And as you'll recall, the county's adjacent to British Columbia, so a lot of those smoke impacts end up right there. So this is what smoke looks like in the valley. So my colleagues who work there in this area have said that they experienced a biblical 40 days and 40 nights of smoke this past summer. And this is about 3 p.m. in the afternoon. And the circle up in the left corner is the sun, in case you couldn't find it yourself. So it's very dark and oppressive throughout the summer. And it's not just in the summer. So for Okanogan County, smoke is a 4-season issue. This is a picture of my colleague Liz and another person who works with her in the Methow Valley Clean Air Project, doing a chipping event where you bring in your agricultural and backyard debris and as an alternative to burning it in your backyard, because there's a lot of agricultural burning. They have wood stove use, and there's also the prescribed burn smoke impacts, which is a Facebook post that you can see on the right from their organization communicating the risk and showing those red dots of those air quality impacts. So they're seeing this all the time. And so this is a slide that my colleague Liz Walker from the Methow Valley Clean Air Project presented last week at the EPA Region 10 smoke management meeting, where she discussed the community's priorities in dealing with wildfire smoke. And I'm just gonna read them to you because I think that they encapsulate a lot of the themes that we've heard throughout the past 2 days and show kind of the resonance of those concepts. So the first is target sensitive populations and those who care for them. The second is to promote the importance of clean indoor air. The third is to make finding cleaner outdoor air and indoor air easier. The third is to address the mental health and well-being impacts of prolonged smoke episodes. So not just those clinical mental health impacts, but how being in smoke for 40 days and 40 nights really just impacts your overall sense of your health and your happiness. To coordinate and enable key partners to build disaster preparedness and response systems that address not just wildfires, but also smoke. To improve risk communication from fire management agencies, and to promote self-sufficiency through emphasis on how to protect health. So we've been working with the Methow Valley Clean Air Project and other partners in Okanogan County since 2017, and I'm just going to highlight some of the activities that we've been doing with them to show you how an academic organization is partnering with a community to build resilience prior to an event. So the first thing we did was we stood outside 2 grocery stores, my students and Liz from the Methow Valley Clean Air Project, to survey people from the community about how they were receiving smoke information and how they would like to receive smoke information. What did they need to know to be able to protect their health? We facilitated the establishment of a purple air monitor network in the valley so that we could get some more spatially specific air quality and that the community could help find that cleaner air more easily that they wanted to. We hosted community and stakeholder conversations to determine community priorities and needs. We've analyzed content of emails that are about wildfire risk to determine whether or not smoke risk was communicated by the U.S. Forest Service and others managing wildfires so that we can make practice-based recommendations about how you can include smoke risk and efficacy information, so what you can do in the event you're exposed to smoke in those informational materials that are being sent out. We've interviewed people that have hosted those clean air sensors to understand the impacts, so those purple air monitors, to understand why they want to participate in the citizen science endeavor, and also to figure out how those monitors are actually helping them to understand the risk that they're experiencing. and to minimize that. We've hosted community outreach events, and we just wrote a grant, which is under review today, so send us good thoughts, about prospectively assessing the health and well-being impacts, particularly of wildfire smoke exposure in the county, and also to develop together strategies that we can use to minimize risk and to help build that evidence base about those strategies. And the picture in the corner is one of my students working with some kiddos to set up one of those purple air monitors in the valley. And the picture underneath it is some findings from one of our community conversations that we've hosted. So from all of this, we have some ongoing questions that the community wants answered, which I think match nicely with some of the questions that my fellow academics have raised over the past couple of days. So one is, how is the smoke going to make me sick? How do I survive indoors during wildfire season? My colleague Liz Walker will say she has 2 little kids, and when they get really upset, she always says to them, just take a deep breath. And you can't take a deep breath in the smoke. Should I have my child or baby wear a mask? This is a big one, N95 masks in particular. We're telling people that kids are most at risk, and then telling them that the kids aren't recommended to wear the masks, and we've had people order them from China, and we just don't have the evidence about whether or not they're safe and whether or not they're effective for children. How do I know my indoor air is clean? Where can I go to find clean air? What are the air quality numbers? Why are the air quality numbers I look at online different? So I mentioned our Washington Air Quality Advisory is different from the EPA Air Quality Index. How do you interpret all of those different numbers when one says it's healthy and the other one says it's not? What does several weeks of bad air per year from wildfires mean for our long-term health? So that's that long-term exposure, but it's also the cumulative exposure issue of those 4 seasons of smoke. It's not just smoke we're being exposed to, it's all of this other stuff. And am I going to have to move away from my home? Is smoke going to be such a regular occurrence that I'm going to have to leave? So these are real issues that our communities are facing, but I would like to point out that this smoke issue is not just Okanogan County anymore. This is Seattle in September 2017. You saw that other picture of 2018 where there was no clean air in the entire state, and that included Seattle. So we're seeing urban smoke impacts as well. And after 2017, we got some calls from our practice-based partners that said, what do I do? Given our unique population, we have we have a lot of refugee communities, we have young people who want to exercise, we have a whole ton of different groups of people, given our unique climate. So Seattle, for those of you who don't know, rains a lot, and it's also pretty mild. So we don't have a lot of air conditioning in Seattle. And so when we tell people to close their windows because of the smoke, it's really hot. And is that the right message? And our infrastructure. So we also don't have a lot of air conditioning or cool buildings in Seattle generally. So they want to know, how can risk be controlled and how can risk be communicated for wildfire smoke specifically? And so in response, on October 30th, 2018, we hosted at the University of Washington what we called the Wildfire Smoke Risk Communication Stakeholder Synthesis Symposium, the worst named symposium of all time, thanks to me. We convened about 76 practitioners and academics from across the state, including University of Washington, other academics, local and state public health agencies, air quality agencies, tribal officials, to talk about what evidence do we need as a community to build resilience to wildfire smoke. My animations are gone, but we had 4 World Café discussions. So World Café is a facilitated discussion where you move around, and it is intentional, and it's that it is deliberatively trying to curate local knowledge. So trying to learn from these practitioners what evidence is actually necessary. We focused on urban, rural, sensitive populations, and occupational groups. And we asked 4 questions. Who is uniquely susceptible in these different subpopulations or communities, and why? How can we effectively communicate risk to this population? How can we reduce risk? How can research improve preparedness and response to future wildfire smoke events? And so what we really wanted to do was to build a practice-based research agenda where we could figure out how we can all work together in Washington. I heard the question earlier about an anchor institution, and my colleagues and I firmly believe in that we are a public institution and we're there to serve our community. how can we all work together to address these issues? And so we've identified a lot of different research priorities across exposure science, health risk research, risk communication research, behavior change and intervention research, and legal and policy research. But at the core of it is that we need a plan. We need some research infrastructure. We need to be able to figure out how we're going to measure exposure, how we're going to leverage measures from different cohort studies. We need to figure out how we're going to all work together in advance of the event to be able to do this in real time and to address some of those disaster research challenges that were addressed earlier or discussed earlier. So this is just the beginning, and I'm happy to talk to you about those research priorities. We also have a paper that's currently under review that I'm happy to share with all of you when and if it's published. But we have, already, this was in March, this headline, The New Normal, Washington State has already logged an unusual number of wildfires in 2019. As of March 24th, when this article was written, we had 50 wildfires, 49 of which were on the west side of Washington, which is, Seattle's the Emerald City. We're lush and green and wet, and this is not typical. So we're expecting another bad wildfire season. We're in a drought, and we need to figure out how to work together to make progress together. And so I just want to thank my fantastic students and faculty collaborators and these community partners that I discussed in helping us move forward together. And so thank you.